Welcome once again. Welcome to the second session. Good evening to all of you. Dr. Tanzilia, I was not able to see you. I was about to say that there's a lot of, darkness around you, but it's good that you have your light on. Okay. So last time we were discussing the first topic, and that was about importance and relevance of communication. We did try to understand that how it is similar to our day-to-day communication and how it is different from day-to-day communication, because we are dealing with patients, so it requires more mindful interaction. And then we were discussing about the benefits. The last point that we discussed was how is it beneficial for all of us to learn communication and then also use it in our day-to-day communication with patients, their family members, and also our fellow colleagues. So do you remember the points that we discussed under this particular point? Do you remember? Maybe 1 point per person we can cover quickly. How are you going to be benefited? How are we going to be benefited if we learn how to communicate effectively and we communicate also?
Can change the attitude.
Definitely.
Doctor-patient relationship.
Wonderful.
It is the most common cause of medical negligence is defective communication.
Mm-hmm. Absolutely. I think that's one of the concerns we all have, that the doctor-patient relationship is actually the biggest concern right now, and definitely. And then the errors that are happening in the patient care, that probably we never realize that most of them are because of the communication failure. These two are very, very important points. What other benefit we have?
It improves the workplace function and the interaction between our colleagues and staff.
Absolutely. So that's another concern, because unless you have good work environment, people will not give their 100%. And also, we spend 8 to 10 hours in our workplace. I would rather say more than that. So it's very important to create a very healthy work environment where people enjoy their work, they're happy being there, then also they give their 100%. And it requires all the attention and concern and care, because there can be small error or small lack of interest can lead to fatal result. There's no doubt. Any other point anybody wants to add to it?
Satisfied patient himself or herself becomes an advertisement for us.
Wonderful. Yeah, definitely. I think that's an important point. 75% of your patient footfall comes from your patients who go and talk good about you. So it's very important to send your patients satisfied, happy. Thank you for adding that point. Any other point that comes to your mind, whether we discussed or you think you want to point out? Personally, how are you going to benefit from this? Personally, professionally? Conflicts will go down. Even with your team. Plus, I think the usual aggressive reaction we receive from the patient is because they're dissatisfied with the way we deal with them. If we handle them carefully, if we manage their emotions and their expectations, we can actually manage most of the aggressive reactions right in the beginning. We can control that. So there are a lot of benefits to us, and also the allegation that we normally get to hear from patients that we were not very prompt and we did not give 100% attention and we did not look after the patient well. Mostly there is resentment behind it, and that comes as a false allegation on us. And when they went into the detail, usually they found that it was mostly because they were not happy with the way they were treated. So coming to the point of how will the patients be benefited? If we all communicate effectively with the patient and their family member, what do you think will be the benefit? How will the patient be benefited?
Patient will be clear about their expectations.
I suggest something. I'll suggest something. Either you raise your virtual hand, then I will know whoever has raised first. So, well, I request that person to. So it's like, yeah, great. Okay, Dr. Lata has raised, and then others are also please requested to. Yeah, yes, Dr. Lata, go ahead. Yeah.
Patient compliance will increase. So that is definitely going to benefit in management of things.
Definitely. I think a lot of time the patient doesn't understand exactly what we are saying. And we assume we have explained very well. And then when patient does not comply with instructions, we are very unhappy. And the confusion is that they have actually not understood. But if you have good rapport, whatever you say, they are more likely to trust you and believe you. Thank you for bringing that point. I think Dr. Sri Kumar, I think you raise your hand and then
Yeah,
Dr.
yeah. I was going to say that to put that point, I said that it improves the trust between the doctor and the patient, because that is the foundation of the doctor-patient relationship.
Absolutely, absolutely. There's no doubt about it. I think once the foundation is laid, the task becomes easy for both the parties, for us as well as for the patient. And that's a very important, point that we have to earn in our favor. Thank you. Yes, Dr. Asha, you have a point to add. Go ahead, please.
I suppose it is the continuation of what they said. Once the trust is there, the healing process half is done. That's what I was going to say. So the treatment outcome is definitely done, halfway done.
Excellent. You have brought a point that's very, very important. I'll come to your point once again, but I can see a couple of hands. Dr. Sonia wants to say something, and I saw somebody else also raising the hand. Yes, Dr. Sonia, please go ahead. Yeah.
Yeah, actually, many times they don't know what is happening. And if we really want to empower them in decision making, they should clearly know what is going on. So
Absolutely.
the whole idea is to empower the patient also in the whole process of treatment. So if that has to happen, the patient has to be clearly communicated in the way he understands. So that he knows that what the procedure or whatever treatment we are undertaking is, it may be complex sometimes, but at least partly that can be understood, and their stress and anxiety also can be brought down.
Absolutely. I completely agree with you. And one of the major benefit of this communication will be the onus of outcome will not completely be on your head. Normally, we feel responsible for the outcome. But if you have shared plus and minus of any procedure or any intervention, and patient takes a well-informed decision, they know that there's a risk. They know there's a possibility of this complication. They know the outcome may not be as we are expecting in spite of all the best effort. So definitely then they don't tend to blame us for the outcome. That's another very good point. Thank you so much, Dr. Soni. Yes, Dr. Manju, you wish to say something? You wish to add a point? Go ahead, please.
Among the team members will result in lesser chances of medical errors, which will ultimately benefit the patients.
Absolutely. So if the patient understands well, there are less chances of error, then compliance improves. And like the point that you raised, Dr. Sonia, that is actually the healing, improves. That's the point I want to bring in here. We normally think when we talk about placebo, and we normally make a mockery of the word placebo, honestly. We give distilled water and say, oh, see, I have given distilled water and the patient is saying I'm relieved of the pain. We make fun of it, honestly, if you agree with me. But placebo is actually a scientific effect that the patient experiences because of the good communication the patient has received. So let me quickly share the screen with you and show you a couple of studies. There are n number of studies that you can, get to read that have talked about the benefits of communication to the patient, where the results have changed just because the patient had good rapport and good understanding and good communication with their doctor. So these couple of studies that I'm sharing with you, like this study, they have shown that patients who experience good communication with their care provider, they actually report better pain control and improved response to pain management modalities. So that is why you must have seen a lot of time when they go to quack, they come back, they write the same medicine. Or if they go to another doctor and that person writes the same medicine, patient says, unki dawai se aaram aaya. I'm better because of his or her medicine. Maybe the doctor was good communicator. And you will see in private practice also, most of the successful doctors have good communication skills. That's why they are able to win their patients' confidence, and patients also respond better. Another, couple of studies that I'm sharing here that says that chronic conditions like diabetes, high cholesterol, hypertension, HIV, they have also reported better control and effective management of their condition. Again, you can see the benefit of communication. Maybe compliance is better, maybe understanding is better, maybe communication is better, but all that helps in better management of the condition. Even studies have reported improved outcomes after cardiac surgery and decrease in post-operative complications such as cardiac arrhythmias. I have listed the sources of these studies that clearly show that it's not just the feeling or the belief that, okay, I'm in safe, but the patient actually respond well to the condition. So as some of you have already mentioned, that improved patient compliance lead to better outcome, because when patient follows your instruction better, their perception of the care is changed when they see you communicating, see your team communicating very well, because they start feeling that they are in safe hands and they are among knowledgeable people. So their perception of the care changes. All that improves, their satisfaction, and ultimately the outcome gets improved. Now, if I may ask you, how are the organizations benefited? Because we are all part of an organization. So how are organizations benefited if there is good communication environment in place? What do you say? You can,
Patients.
sorry, you can?
Get more patients.
Obviously, definitely, you can get more patients, because ultimately we all want to, do maximum work at any place. Absolutely. What else? Yes, Dr. Lata, go ahead, please.
That is a smooth running of the organization day-to-day activities. If there is exact communication of what has to be done, everybody knows what they have to do. So the organization
Definitely.
can.
So there's more coordination between the departments and teams together. Thank you. Wonderful. Any other point anybody wants to add? So as very rightly said by all of you, that if we all communicate effectively, the biggest benefit is that there's a good work environment. Everybody knows that they have to, communicate effectively, and they would expect that there will be a communication, coming across. That would definitely enhance safety and quality, not just for the patients, but for the service providers also. There is greater job satisfaction, which is very important, because today the problem is attrition, and attrition majorly is because people don't change jobs, they change their bosses. If they're not happy with the work environment, if they're not happy with their immediate bosses, they tend to change their jobs. So if you have good work environment, people stick with you in spite of all the hurdles or all the problems that they face. Then patient experience scores goes up. If you are taking feedback, you will see positive and better feedback coming from your patients. And we all know that patients have tendency to go on Google and write reviews about us, and people read their reviews and value those reviews. So automatically you get good reviews, if you have good work environment and good communication at workplace. Then of course the patient loyalty improves. Patient stays with you, and not only patient stays with you, they also recommend to others to come and visit you. So we all want something like this, but for that we have to remember that clinical communication is not just about niceties. It's not just that we have to be nice and good, but it is actually therapeutic communication that happens between you and your patient. So when it comes to helping the patient make informed decision, or helping the patient, fine-tune their expectations, or helping the patient understand the poor prognosis, all that requires understanding of how do you really communicate all that with your patient. It is clinical communication between you and your team, because we all know healthcare is very complex and it is multidisciplinary, and a lot of people in the front, in the background are working hand in hand to provide best care to the patient. So that communication has to be accurate, has to be precise, to make sure that there are no errors and there are no lapses in the care. It's part and parcel of the treatment, and it is not optional. I think we thought it's okay the way we communicate. It's important to do good surgery or good treatment, but we are seeing, in spite of good surgery and good treatment, things are not going the way we expected. And implementing communication processes has a direct impact on the continuity of care, patient safety, and treatment outcome. I think all three are major purposes and goals of our quality care. There are set of communication protocols that every healthcare professional must know and practice them. And there are a lot of ways to learn. Like, for example, we are learning some topics in this program, but this is just the beginning of your journey. I'm sure you will be further trying to explore what all can be learned under it, and what all can we teach to our fellow professionals or to our students. Okay, so this is in nutshell the topic 1. This was the part that was left. So I thought we'll just cover it quickly. Going to the second topic. Before that, any question about this topic? Anything you wish to say or ask? Okay. So The second topic, as I said, is about developing communication competencies. So when I was, preparing the content for this, today also when I was revisiting and trying to make some changes, I had a thought that all of you are quite senior, and I'm sure most of you must be aware of the, basics of communication or the nuances of communication. But the idea of integrating this topic in the master trainer program is that it is not just for you to learn, but it is important for you to remember that this is something you need to talk to your fellow professionals to whom you want to train. So your nurses, your paramedical staff, your junior residents, your other staff members who are handling patients, they need to be reminded, because a lot of times when patient comes to you with their problem, you listen to them and calm them down and actually address their problem. But before they come to you, they have met actually a couple of people, maybe the security staff, maybe the front desk staff, or your nurse on duty. And by then, actually the damage has been done. And you get a situation where you have hardly anything left to be, do or to correct them. So this topic, please attend with the idea that if anything that you are not doing, it will remind you that you need to do. If you're already doing, it will validate your working, that, okay, this is something really good that I'm practicing. And then all these skills you have to really transfer to your participants, to whomever you are going to train. So to start with, I'm going to show you 2 videos. So these videos have been done by Indian doctors. I'm very happy that they have done this job for us, because normally we get to see Western, videos, so we don't relate with them the way they, communicate with their patients. So what I want you to observe in the video is to focus on 3 things. One is how that doctor is, communicating, how the doctor is talking to the patient. So verbal part, language part, please focus on that. The second that I want you to focus is on the tone of voice. And the third point that I want you to focus is on the body language. You could also, see, is there empathy? What is the attitude? Because all that is part of communication. You could even, focus on that. So I'm going to show you the first video, which is like how sometimes we do not realizing what is the right way of doing it. So give me 1 second to start the video.
Next.
Is it audible?
Yes, madam.
What? Doctor, my leg is swollen and painful. Since when? For the last 5-6 days. What were you doing? Why did you wait so long? This looks pretty bad. Doctor, I thought the pain was just a strain in the leg. Anyway, what do you think now? You could have waited for some more time and we could have amputated your leg. Leave it. What's your sugar level? It is under control, doctor. The fasting was 140. When was it done? What was your HbA1c? It was 4-5 months ago. Actually, HbA1c is an expensive test and I was feeling all right. I can't understand. You do investigation according to your will. You don't take proper treatment. You don't follow our advice. I don't know why you need doctors. And you come up with all sorts of complications like this. And what did you do with your leg? I went on a pilgrimage to Sabrimala, so had to walk barefoot. I might have injured, I think. Barefoot? Hello? Yeah. Who? The patient Ram, HIV positive patient. So he doesn't want CT scan. So tell him if he wants treatment, he needs to undergo CT scan. Right, what does he think of himself, yeah? Prime Minister or President? See, discharge him against medical advice and tell him not to come to this hospital once again. Okay? Yeah, bye. And you got this boon. I'll tell you, if you go once again, you will also go near the God. Didn't I tell you about the foot care when you came last time? Huh? And your smoking is continuing without interruption, I guess. I have reduced a lot, doctor. I am smoking only 1 or 2 cigarettes a day now. And understand your attitude here. You do smoking, you are overweight, you don't take medications, you don't do investigations. I don't know what to tell you. I'm trying, doctor. And if you don't want to see me, I could consult someone else. See, whatever I'm telling is for your good. I don't know how to tell. I gave you information leaflets last time and you're not following my advice. And if you don't want to see me, it's fine with me. I've got enough work to do. I've got enough patients to see. Sister, please call the next patient.
So how was it? Okay. So we'll not go into how, but we will go into what was not okay. So I would request each one of to give 1 point so that everybody gets a chance to share their thoughts. What do you think was not appropriate, not okay? Raise your hand, and then 1.1%. Yes, Dr. Harimohan, sorry. Yes, go ahead, please.
Yeah, from the beginning, he was making the patient guilty. Of course, the patient had done enough to be guilty also, but that should not have been his attitude. His body language, everything suggested that I'm fed up with you. You can do whatever you want. I told you enough, but you're not following it. And actually, I think he just gave the leaflets. He never sat and explained to him. And so it was.
So we'll just point out the error was that he was making the patient feel guilty. Thank you. That was a very good point. Thank you so much. Yes, Dr. Lata, go ahead, please.
Is he doing something when the patient entered the clinic and no eye contact with the patient as soon as the patient entered?
And we see this happening a lot of time. We see this happening a lot of time. I'm sure some of us also must be doing it. If we are busy doing something, patient comes and literally stands on our head, and then we make an eye contact and we say, please. And in government setup, sometimes, खड़े रहोगे क्या? बिठाऊं क्या पकड़ के? I mean, we go to the extent of being that rude with the patient. I hope you will agree with me. Thank you for bringing that point. Yes, Dr. Deepa, please share your point.
Rude behavior, and he was having he was talking to talking about another patient in the phone call, and that too negative behavior.
That's a very important point that you picked up. A lot of time we are on phone, not realizing that the other person is overhearing our conversation. The way we are talking, the words we are using, the attitude that we are, and not only in front of other patients, sometimes in escalator, in cafeteria, in corridor, others are observing and listening to our conversation. I mean, and that reflects really bad on the patient. What is our way of, and the patient must be wondering that in my absence also they will talk like this. Thank you for bringing that. Yes, Dr. Asha, please go ahead.
He was not only rude, he was even insulting the patient. He said, you go again to Sabrimala barefoot, you can reach God by that itself. So not only rude, it was quite insulting too. Maybe his intent was good, but the way he presented it would definitely make the patient run away from that place.
He was making mockery of patients' religious beliefs. And we have to remember that it is one of the patient's rights that we have to respect patient to do. If we don't agree, if the patient is not doing things right, we have ways to explain that to the patient. And you very rightly pointed out, most of the times when we shout at the patient, our intention is good for the patient. But there are two things. One, if my intention is good, then my way of communication has to match it. That's one thing. And second, please remember, if you are handling 70, 80 patients a day, it's a government setup kind of a thing. And if you are shouting at each patient, imagine your own mental and physical health by the end of the day. Instead, I would rather suggest put the ball in the patient's court, explain to the patient the risks involved or the disadvantages, and let the patient take his or her call. Whatever they want to do with their life, that's their free will. You getting angry or getting annoyed and shouting at the patient is not required. So that's called detachment. That's called detachment, where you draw a line that my duty is to explain to my patient and rest is patient's responsibility. Thank you for bringing that point. Yes, Dr. Mini, you have a point to say?
Patient was not greeted as soon as he had entered the room. And straight away he was going into the negative comments. And he has not was not even looking into his eyes.
Yeah.
At the same time, he was, when the phone came, he was disclosing the identity of the HIV patient also.
Very important point. Very important point. We talk about a patient's health condition in front of other patients. In the OPD also, when we are interacting with our patient, there are other patients who are overhearing. There's a risk if somebody gets to know some personal or confidential information. In our country, patients don't sue us. But we know in the Western world, that's one of the major reasons for suing, because they say that you have shared my information with the other patients or other parties. So that's a very important point we need to keep in mind. Thank you for bringing that up. Yes, Dr. Venom. Go ahead, please.
I think what stuck with me as a psychiatrist was the jibe regarding smoking. So there was a gain in behavior. I think it's very important to appreciate gains, positive changes that happen. And we often forget to actually compliment the patient with regards to the effort. And it goes in a long way in actually possibly leading on path of abstinence towards that.
Thank you for bringing that up. We all have to remember that those who are into smoking or in alcohol, it's very difficult to quit. And they really require a lot of positive reinforcement to actually, stop doing that, or at least reduce it as much as possible. And that for that, we really need to encourage the patient and motivate the patient to do that. But his way of, he was more like a critical parent who would shout at the child to make the child better. So that approach was not desirable. Thank you for bringing that point. Yes, Dr. Rajalakshmi, please go ahead.
He didn't even care. He didn't care to look at the limb, nor did he show any sympathy or empathy.
That's true. That's true. Even if I don't go for that he did not look at the, of course he should have, but his overall demeanor was very unpleasant. And if you saw at the end, what was the feeling both of them were left with? They were both dissatisfied. They were both very unhappy. Dr. Raki, you wish to say something? Please go ahead. Please unmute your device.
Yeah, what I thought was the tone of his voice, the way he was presenting, he was absolutely, there was no empathy. He was insulting him, sarcastic comments. So all that is a complete no, I think.
Absolutely. I completely agree with you. You pointed a very right, thing. His tone of voice was very rude and authoritative and intimidating. And also, what about the facial expressions? Did he smile even once? Did he look happy seeing the patient even once? Actually, a lot of us have forgotten to smile with our patients. We work very mechanically with our patients. We think, what will happen if we smile? What will happen? Why don't we, smile?
Smile is selling maximum, incurring least expenditure.
We don't smile. There's a reason. There's a reason behind it. There's a hidden agenda.
Because you become more familiar.
We don't want to create that comfort for the patient, where the patient comes up with their questions and asks us to explain further.
We feel we are dominant.
Yes, we create that distance that they are not come close to me and I have no time to answer your questions. So we have that kind of a demeanor. We kind of show that I'm not approachable, I'm not accessible. And sadly, that's what is bringing, wrath of the society, because they feel that we are not sensitive to their plight and we are, being rude and authoritative with them. So let's see this second video. Could he have done in this manner? Any other point from anybody?
So, Madam, I just wanted to say that he went on to say that we'll have to amputate your foot. That was too harsh. And he was totally angry. And the end of the thing was total breakdown, because the patient went on to say that, okay, fine, I don't want your treatment. So then what's the point?
And very honestly, I've personally seen, and I'm sure you also must have seen in your own practice, doctors who are very rude, ultimately they end up having very few patients with them. They lose their clientele, because there was a time when patients still went to the doctor if he was a good doctor and if he was rude. I think I made a mention last time also. My mother used to take me to a doctor when we were kids. I'm talking about 40, 50 years ago. The doctor was very rude, but my mother said, no, he is an excellent doctor. Just with one dose of medicine, you all become fine. So whatever he says, that's okay, but we are going to him. Today, nobody will come. If you are rude, they'll say, thank you so much, I can go to another doctor. Because they have options available. We really need to understand that that's not the right way of bidding your patients. So let's see the second video. Could he have dealt the same situation in this manner? Okay.
Next. Hello, Mr. Kannan. How are you? Please take your seat. Thank you. What can I do for you?
Doctor, I think I have a problem with my leg.
What happened?
4-5 days back, I went to Sabrimala and I had to walk barefoot for some distance.
Mm-hmm.
I'm very scared now because my leg is swollen and painful in the last 4-5 days. And I think I did a stupid thing by walking barefoot.
Let's see what we can do. Good that you realize the importance of foot care. Meanwhile, how are your sugars?
Actually, my fasting sugars was 140, but it was some months ago. I was feeling all right and I didn't do the HbA1c. It is so expensive,
It is expensive indeed, but it is so important to get the investigations prescribed by the doctors, because otherwise it's very difficult to give the treatment, and treatment may not work as well. Anyway, can I examine your leg?
Yeah, sure. Sorry, sir. It was my mistake. I didn't do the test.
Hello? Yeah? Yeah. Excuse me for a moment. Yeah. What's the name of the patient? Mm-hmm. So he doesn't want the CT scan, right? Yeah. Try to explain to him the importance of CT scan. Yeah. When I come for rounds, I will also tell him. Okay. Thanks for informing. Thanks. Bye. Sorry about that. You got infection in your leg. So how are we doing regarding the quitting the smoking?
Regarding smoking, it's doing good. Actually, I brought it down to only 1 or 2 cigarettes per day now, doctor.
Oh, that's good. But total quitting is very important. See, if you have reduced from 1 pack to 1 or 2 cigarettes per day, quitting that is also not very difficult, you know. And how are we doing regarding the exercise?
Yeah, going on, but I must admit, not so regular.
See, exercise and diet are as important as your medicines, if not more. But for the time being, you need admission for sugar control and control of this infection. Is it okay with you?
Whatever you say, doctor, you have to cure me this time. And hereafter, I will definitely take care of myself. This will not happen again.
Yeah, we need to control your sugars and control the infection. Otherwise, it may go for gangrene and may lead to further complications. Now, the sister will go through the procedure and admission process. Okay. And meanwhile, you have this leaflet and you can go through it, which will help you to follow the regimes. Okay. Thank you very much.
Thank you so much, doctor. It was so kind of you.
You're welcome. Thank you.
ज्यादा हो गया? चाय में चीनी ज्यादा होगी? So the idea is, if you are mindful of what you're saying and how you're saying, you can handle any situation. And if you saw the duration of both the videos, second video was shorter. And he could definitely communicate very effectively. We saw his verbal, non-verbal, body language, everything was in congruence with what he was saying. And that is also, he's an excellent doctor, so I'm sure he must be practicing in the same manner. But if you pick these, finer details, they are not time consuming, but you just need to be mindful that yes, they have to be part and parcel of your communication. Any idea what percentage of your success comes from your communication and interpersonal skills? Go ahead, ma'am. Dr. Deepa, go ahead, please. Please unmute.
Repeat.
60%.
50%? Okay, good. Yes,
Madam,
Dr.
can you repeat the question?
Okay, I will repeat the question. Any idea what percentage of our personal and professional success comes from our communication and interpersonal skills? Dr. Asha, you wish to say something, and then Dr. Rakhi, please go ahead.
I would say more than 70 to 75%.
70%. Thank you for that answer. Dr. Rakhi, what do you wish to say?
I think coming to good communication, I feel, for me personally, I feel more than the patient, I am also happy. So I feel my personal, well-being is also being taken care. What if the patient is going to be angry and, walking out, that whole day is gone. Rather, the patient who comes in and the patient says, see, I have brought my neighbor to show you. Because
that's your day that you are so happy and
exactly
happy inside.
So I think more than like how Asha ma'am said, around 80% success will be there with good communications. That's the thing.
Quite close gap, I would say, very, very close, estimation that we have said. Somebody wrote 90%. I think Dr. Rafiq said more than 90%. I completely agree with you. There's a study by Harvard University. They tried to get in touch with their alumni with the idea that students who had very high IQ would be happy, successful, and doing well in their life. To their surprise, people with higher EQ were more successful and satisfied and happy in their life than people with higher I feel. And I'm sure in your life also, you must be seeing people who are extremely, extremely professional, extremely knowledgeable. And now, of course, the place you are, I'm sure you can refer your family member to any doctor and just give a call and say, okay, I'm sending my aunt or my sister or my brother or whomever, and you can talk to them. But even if you have to now call somebody and say, and there are two doctors with the same qualification and same experience, I am sure you will send your relative to the person with whom you connect to it, with whom you are comfortable talking, with whom you think you can discuss the case, comfortable. And that's what is exactly true. 85% of your personal and professional success actually comes from your communication and interpersonal skills. Imagine the importance of this, skill. But unfortunately, we hardly pay any, importance and relevance to this. Even in our programs, if you see, even in the medical education, now we are trying to, kind of work on it. But very honestly, we never thought that this is this important. So I'm sharing the slide with you and trying to look where the slide is because there are multiple windows open on my laptop. Give me a second to open the presentation. There we are. Okay. So as I said, 85% of your success and your, happiness comes from your communication and interpersonal skills. Very rightly said by Dr. Raki, that it's not just the patient who's going to be happy, it is you who needs to be happy. Don't do anything for anybody else, but do it for yourself. Yes, Dr. Harimohan, you have raised your hand. You wish to say something. Please go ahead.
Yeah, I do not agree with this 85% because medicine is also a bag of skills. Especially if you have an interventional cardiologist who communicates well, but does his job shoddily, he's not going to be a big success. Or you take a surgeon. I had a professor of surgery who was an excellent communicator, but a very poor surgeon. So I don't think it's 85%. Personally, I feel it should be around 50%. Your skills
Sir, we are misinterpreting the results. We are considering that two doctors with the same caliber.
Exactly. I would also think of how good he is in his job.
No, both of them are excellent at their job. But their satisfaction, their success, their contentment would be different. Person who has higher EQ, higher interpersonal skills, higher communication skills, they will enjoy their life more. They'll be more happy because they're creating happiness for themselves and for everybody else. You may have seen clinicians who are excellent in their work, but they're very snobbish. I've seen them throwing instruments in the OT, shouting at their nurses, shouting at their residents. Do you think, even if they're best of the clinicians, are they creating happiness around them? That's the thing. I'm not saying that you have to be below average a clinician and still you will be successful. That was not the point I was trying to make. The point was that if you have this, you definitely enjoy more happiness. But thank you for clarifying. Thank you for clarifying that point. Thank you. Okay. So going ahead with the discussion, as I said, that a lot of your happiness and satisfaction and success comes from communication. If I may ask you, in how many ways do we communicate? Any idea? In how many ways do we communicate?
Verbal, non-verbal.
Verbal, non-verbal. And non-verbal includes what all?
Writing.
Gestures, your body language.
Eye contact.
Wonderful. You'll be surprised to know that only 7% of the communication happens through words. Most of the communication is through your body language and your tone of voice. A lot of time when we are watching an interesting song or a movie, we just get engrossed in the picture or in the dance. There's no verbal communication. We are not able to even understand the language or the words that the person is, singing or saying. But we still like that because we are getting so well connected with the body language and the tone of voice. In this context, do words matter? If I may ask you, We are saying just 7% of the communication happens through words, but do words matter?
Yes, they do.
Yes, they do.
Yes. How many of us are very mindful of what we are saying and are very, conscious that, okay, this is not the way to say. And how many of us really regret later on saying, oh, that was not the way I should have done it?
Ideally, we should be.
Exactly. Dr. Menon, you have raised your hand. Do you wish to say something? Please go ahead.
I think words really do matter, especially again coming back to my field where there is a lot of stigma, and I work with people with addiction. So using words like addict or alcoholic, all of this have a great deal of negative intonation, and it is very clear when you use these words how it reflects upon the patient. So yes, I think we should be extremely mindful of the language we use, the words that we use.
Thank you. I think that's a very interesting, point that you have brought up. Sometimes you just call them. अरे वो diabetic है ना जो उसको देखना. अरे वो जो कोमा में है ना उस patient को देखना. अरे जिसके appendectomy में, मतलब actually we don't call the patients by name, we call them by their disorder or by their surgery. What we, I think it's a very important point that you have brought up. Thank you. Although that was not in the discussion, but then you have brought it up. Thank you so much. Dr. Rakhi and Dr. Asha, you wish to say something, but I will make you hold for few seconds. We'll do a small activity to understand, do words matter? So I want any 5 volunteers to raise your hand, because we are going to do a small activity so that I know these 5 people are with me. So 2 people, okay, Dr. Rakhi and Dr. Asha are there, and Dr. Menon is also there. 2 more people. 2 more volunteers. Okay. Dr. Paul is there, and then 1 more. Who else will raise hand? Okay, Dr. Raja Lakshmi. Thank you. So 5 of you keep your video on. Rest of you for few minutes, switch off your video, but you are there with me, and you are just going to observe the whole activity. And keep noting whatever points come to your mind. Those who are observing us, those who are going to observe us. So Dr. Mukundan, is it okay if I switch off your video for a few minutes? But if I switch off, then you will have challenge. Okay, it's okay. I think he has managed. Okay. So we are 6 of us. 6 of us? Yeah.
Yes.
Great, 6 of us. So imagine that we are going for a picnic, and we are doing the planning part of picnic, and we start the discussion. So each one of you will be saying something, but the discussion will start with a very typical, in a typical way. I'm okay with the plan of going for picnic, but. So normally after but, what comes?
Negative.
Some objection, some excuse, some reason that either this can't be done or this cannot happen, or I'm not okay with the idea. So I'll make the beginning, and then I'll pass the baton to Dr. Rakhi, and Dr. Rakhi, then you pass on to the next person. So I am okay with the plan of going to picnic, but I have friends coming over at my place this Sunday. So it wouldn't be possible for me to come. Dr. Rakhi, your turn.
I'm okay with planning to go for the picnic, but Munnar is too cold. I cannot be there.
I agree. So whom do you pass the baton?
Yeah. No, Asha ma'am.
Yes, Dr.
I'm okay with the idea of going to the picnic. Then the place you chose is too far off for me. Long road travel is so difficult.
I agree with you. So whom do you want to nominate after you?
Rajashri ma'am.
Okay. Go ahead, please.
I'm okay with going for the picnic, but I don't have proper company.
Okay. You don't enjoy our company? You're not good company? It's okay. I understand. We have hardly interacted, so I understand. And plus, Dr. Asha is also not going. Okay. Go ahead. So whom do you want to nominate after you?
Dr. Menon?
Okay, Dr. Menon. Go ahead.
I'm okay, but this is the only Sunday I'm free on. So if it doesn't happen this week, it won't happen for the month.
Okay. Dr. Paul, what do you say?
I would very well like to go, but if you had told me earlier yesterday, because I had already planned Now changing that will be a bit difficult. Still, I can try. Let me ask my friend also. If all of us are there, it would have been very good.
But you are not sure, no? You are not very sure.
Yes.
I understand. Okay, so we'll have a second round of discussion, and this time we will replace this word but with and. So instead of saying but, we will use the word and. Okay. We'll do the discussion in the same order. I will do it first and then pass on to Dr. Raki and then the next person. So I'm okay with the plan of going for picnic, and I'll bring food for everyone.
I'm okay with coming for the picnic. I'll be bringing my dog along.
Wow, wonderful, excellent. Yes, who is next?
I'll come for the picnic, and I suppose we'll have a mat and a basket and an umbrella for the beach side too. I'll bring that along.
Wonderful, thank you so much. Yes, who is next?
I'll come for the picnic, and I'll make the games for during the picnic.
Wonderful. So we have almost everything arranged. Who is next? Dr. Menon.
I'll come for the picnic, and I'm free on most days this week. This month, most weekends I'm free, so it should be okay if we plan any Sunday.
So you're okay with this Sunday plan?
Yes, I am.
Thank you. Yes, Dr. Paul.
Yeah, I will also come. I will do something for the children. If you are taking the children some games, something I can arrange.
Oh, excellent. Can I request everybody to come in? So those who were observing and listening to our discussion, one by one, if you could share 1 point each, that will be really nice. So what difference did you see in both the discussions? Yes, go ahead, Dr. Dr. Manju, you raise your hand first. Go ahead, please. Yeah.
The difference that I noticed first was in the second discussion, everyone was smiling.
You could see positive energy. Thank you so much for that, for observing that. Yes, Dr. Deepa, you have to point to
Yes, the word but and. When it was but, all was negative, and it was positive. Just 3 letters made such a difference.
Such a difference. You could see that whole discussion took a different
scenario changed.
Absolutely. What do others say? Yes, Dr. Harimohan, go ahead, please.
Yeah, I was in fact trying to tell I will not be coming, but I'll arrange the transport. But then I can't use and there. I couldn't spoil it. I thought I'll try that, but then so it is fully positive.
Absolutely. You're right. So could you see the difference in the two approaches just with change of one word? And honestly, let me tell you, lot of us use lot of ifs and buts. Even at places where it is not required. Some of us have tendency to overuse this. Some of us will talk of remotest possibility that would not happen, and people will just get confused. How do we answer this question, and how do we, like for example, I'm sharing my personal experience now with you. When we were coming back from Florida, so my husband said, let's take the printout of the ticket. I said, nobody now takes the printout of the ticket. It's there on my phone, it's there on your phone. Suppose if the phone does not work, suppose the phone gets lost. I said, please don't talk the remotest possibilities. So we all have this, habit of bringing in something that's very, very remote. What happens as a result? People are not comfortable discussing with us. They will hesitate coming up with ideas. They will hesitate approaching us for some help. They will automatically know, इनके पास जाएंगे तो ना ही सुनना पड़ेगा. But that doesn't create good work environment. Yes, Dr. Harim, you have to say something. Go ahead, please.
What if the reason is genuine? But
Okay, give me if the reason is genuine, and if most of the times you have not used but, your but will be actually taken seriously, will be valued, will be believed. But what but I am talking about is the tendency to use lot of ifs and buts. And we have people around us. Go to a meeting, you know these one or two people are just there to find fault with what we are doing, to find something wrong with what we are doing. Yes, Dr. Asha, you wish to say something. Go ahead.
Yes, answering to what Hariman sir was saying, if the first person starts with the but, we always tend to bring out more buts. Like even if it is a genuine reason, it will still remain a but. But then if it is a borderline reason, you will shift to an and. The common this thing is about an and. You will shift also to the positive side.
Exactly. And lot of time, and this we will be discussing it further when we'll talk about facilitation skills. So in facilitation skills, we are going to focus on how do you handle disruptive audience. In disruptive audience, you will have people who will always come up with something that doesn't come to anybody's mind. But they'll have, what if this happened? Why did you say this? This is something not going to work. So then you have to really see how many fights can you really fight. So you have to pick your fight. How much are you going to fight? With whom are you going to fight? And how much time and energy you are going to waste into that process. And there are many ways to deal with that. We'll talk about it in session 4. In session 4, we'll be talking. But the whole idea is, if I am using a lot of ifs and buts, people will not be very comfortable working with me. I may not agree. I'm not saying that you don't have to bring up your opinion or just agree blindly with people. No, but there are ways to say. There are different ways to say where you first align with the person and then you come up with your thought that this is what is my concern. If you can help me with this, I think I'll be in a better position to take a decision. Then it becomes a different thing. So can you think of some of the things that you say to your patients? Can you think of often, like we use something? Can you think of any one sentence that you often use or some way that you use that you think is unhelpful and it's not a good idea to? Like Dr. Menon said, sometimes we say addict and addict. And it's hurtful. It's labeling. Can you think of? If you haven't used, you have seen people using, can you think of? Your colleagues, your juniors?
You mean stigmatic words?
Yes, stigmatic word or any dialogue. Tere bas ka nahi hai ye karna.
I am into cancer counseling and oncology and pain management. So we have to be very careful not to use certain words. So we go around it. Sometimes it's not being telling a lie, but it helps. And the other thing is I'm in pain management. So sometimes I don't use the word of the narcotic, which is very familiar. Especially, maybe I will tell them each one about it later. But I have to be careful about certain words, like what Dr. Menon said. It's absolutely true, because that will immediately create a barrier which is very difficult to surpass for a long time.
Thank you for bringing that up. Yes, Dr. Lata, I think you have a point to make. Go ahead, please.
I'm a physician, so I see a lot of diabetics. The one who come regularly and uncontrolled status, I usually get irritated and I tell, if it goes like this, you will end up in renal failure and you have to get dialysis and all done. So that is, I think, maybe after this, I will change my tactics. The way I'm
very glad that you're admitting it. I'm very glad that you're admitting it, that this is sometimes what we say. See, again, your intentions are good. Communication is not what you say, it is how you say. And also, if overall your behavior with the patient is okay, they would not even mind when you use these words. But if I'm rude, authoritative, and little intimidating, then when I use this way of explaining, it doesn't go well with the patient, and they don't take it as though you are really concerned for them. They take it as a personal insult. That becomes very challenging to handle. Yes, Dr. Menon, you have a point to make. Go ahead, please.
I think the most important part that we are prone to is like, but if you're not taking medications, how are you going to get better? I think when people say that they are not adherent as much, but if you're not regular to consultations, if you are 2 weeks late, so I think it's an immediate reaction that comes. It's often not helpful.
Thank you. Thank you for bringing that up. And mostly that's where the communication breaks down. Because we get annoyed, we think patient is not complying with me. Acha, ye bhi. And then also when they say we want to go for second opinion, we again feel we take it as a personal this thing that they are not trusting my competency. Even that comes as a shock to us. So these are couple. Yeah, go ahead.
The other thing is, I think the patient must be comfortable enough to admit to us that they have not taken medications, because otherwise, if there is a complication, it remains unexplained. You may increase the dose of medications needlessly. I think they must be comfortable enough to admit that to us, and then we have to discuss with them what had happened.
Very important point that you have brought up. And we are actually digressing from the topic, but we are not digressing because this is what we are doing. 3 points that you have brought up. One, if I'm judgmental, the patient is likely to hide from me. So that means throughout I have to stay non-judgmental mindfully, because being judgmental is very natural. It comes very naturally. You are a very careless patient. आप time पर नहीं आते हैं, दवाई नहीं लेते हैं, test नहीं करवाते हैं, you are going to end up with renal failure. You are going to end up with diabetic. That's all. That's one thing. And second point that you have brought up is, how do you check whether the patient is taking medicine regularly or not? There's an open-ended question, there's a closed-ended question. Can you give me an example? What would be an open-ended question and what would be a closed-ended question?
Closed-ended question would be just like, what is your name, or how old are you, and things like that. Open-ended question would be something which needs a lot of explanation, just not a one-word answer. You're opening up, how do you feel? Can you talk more about that, or something like that?
So you get more detail. But if I want to check whether the patient is taking regular medicine or not, somebody else, I can see 4 hands raised, Dr. Mini, I think, because
leading questions. Something we are asking for leading questions.
Yes. And how do you, can you give an example of that leading question?
Any medicines left behind?
I hope you are taking medications.
Not a leading question, that's a closed-ended question. Because then there's likely to be yes or no answer.
I hope you are taking medications.
Yes, that's a leading question.
At what time do you take the medications today?
When you say, I hope you are taking your medicines timely, you are indicating that this is what is expected, and if you're not doing it, then it's wrong. So when the answer is within the question, it's a leading question. And what would be the open-ended question?
At what time did you take the medication today?
Again, it's going to be a closed-ended question.
Which all medications you are taking? How long you have been taking?
Okay. I mean, again, we are going into smaller question. If you just ask one-line question saying, ki, tell me about your medicines. What are medicines you are taking and how you are taking? Patient will come up with, I'm taking this medicine twice a day, I'm not taking this, whatever they're saying. So you get to know more about. So it's always a good idea to ask open-ended question. We have a tendency to ask closed-ended question, because we think by asking closed-ended question, I'll get exact answer, I'll save time. But honestly, we end up asking a lot of questions. If you ask one open-ended question, you get more information. I can see, Dr. Mini, you wish to add something? Your hand is raised.
No, I raised for the previous question. Like,
okay.
Say, suppose the patient comes and calls you in the peak of the night or midnight, saying I have loss of fetal movements from the morning. You get so much annoyed, and you'll ask them why you have waited all the time. Like that. So the patient coming in the odd hours, patient coming at the odd hours, having the symptoms for such a long time, and then reporting to us in the late midnight, the odd hours, we feel very much irritated. So that is another annoying point.
So again, here, if I am kind of, throwing the patient or the attendant into guilt or blame game. So there's a tendency that they say, it's been 1 hour since we are waiting outside. Your staff hasn't even checked my BP. And you are saying it's an urgent condition. Even me being here for 2 hours, what have your staff done for me? None of your senior doctors have come to see you. So we have to be mindful. Blame game is very unsafe. I can assert, although I'm going to take full one session on assertion because that's one skill I want every doctor to learn, every healthcare professional to learn. And if you are able to teach this to your people, a lot of fights can be looked after because we should know what to say in the right manner. So if I say, you have brought the patient, quite late. Ideally, this condition should have been, handled as early as possible. But it's okay. Don't worry. Whatever best can be done, we will do. What we are doing, you have communicated, but you have not blamed. A lot of time when we are prognosticating the patient, we say patient is diabetic, patient is hypertensive, patient dawaii nahi khata hai, patient irregular follow-up ke liye aata hai, ye to hona hi tha. I am blaming. I'm blaming the patient or the family. That doesn't. Please mind it. You have to tell the facts, but any patient who is diabetic or has, erratic blood sugar, or any patient who is hypertensive but is not taking regular medicine, these are the common complications we see among those patients. What have you said? Same thing in a very neutral manner. You have communicated the same thing. You want to tell them that you have gone wrong here. But without blaming also, you can communicate the same. That's what I think will help us. Okay. So going ahead with words, I think we had good discussion around it. Again, with our juniors, a lot of time, we are very rude and authoritative. With residents, we are very, sometimes not in very cordial way we talk to them. With nurses, sometimes we are not very cordial. So all these things, kind of demoralize people. They go distant from us. And these are small things. Check kare. Forget about that. A lot of us use tu for our juniors. I think there was a time when we saw our seniors calling us tu, but we thought that sort of love for us. Today, with your own children, you can't use this word tu. Can we? I remember I used this word long ago with my younger daughter. She was much younger. I'm talking about 20 years ago. जरा तू करके क्यों बात कर रहे हो? आप बोलो ना, मैं आपको आप करके बोल रही हूँ. So we have to be really careful about the language part. So second part of the language part is also written communication. So we all know that written communication is very vital in healthcare, and because a lot of things get documented and we all need. So what are the common records that we all maintain that we see in healthcare? Can you think of some of the records?
Case sheets.
Okay, case sheet, very good.
OP tickets.
Okay, OPD slip.
Consent.
I'm sorry, I'm not able to hear your answer clearly.
Consent.
Consent form, okay.
Procedure notes. Procedure notes.
Procedure notes, very right. Progress notes. And this is one of the progress note I received just yesterday, I think. Yesterday or today? It is, what date it is? 1/5, yes. It is yesterday night. From one of my friend who is a gynecologist. She has written that this is one of the, progress note written by my resident. What can you read in this? Tell me, please. Look at the next one. What is missing in this? What is it exactly? What note is it?
Summary.
Lama, huh? Lama summary. And what is missing? What are the errors?
Name. Name is not there.
Name.
Everything about the patient is missing. Name, UID number, other details, everything is missing. And these are the documents we are creating about our patients. This is another document. You can hardly read anything. There was a saying that only pharmacists can read doctors' written prescription. I don't think we have to be proud of this. It's very unsafe. It's very, very unsafe. We got to be really careful. Another OPD slip of a patient. I just struck the name of the patient because I didn't want the identity to be disclosed.
Now with electronic documentation, that's coming down.
There also there's little risk of copy paste.
No, I'm telling the handwriting part.
Yeah, handwriting. Yeah. Now there are orders that you have to write medicine only in capitals. And the best part is there is no signature, or even if there is a signature, you can't identify whose signature are these. And there is no date and time. So this is really very challenging. But yes, I agree with you that ultimately they have decided that we really need to, go ahead with electronic records because that would at least prevent some of the errors because of illegible handwriting. So what are the common errors you have seen in the written one? I think illegible handwriting is the first one, topmost. Abbreviations.
There should be some order also. We need to have some order like the basic history in a few lines at least.
Absolutely.
And then the clinical findings, and then go on to the what happens that day. I mean, there should be some regularity for even the team that is reading. They have to understand it can be a few lines, and then we can write the. I mean, people just.
Format.
In how many medical colleges are we really teaching our students how to go about writing the patient's case sheet? And very honestly, how many of you have actually formally learned?
Yeah, I have been a physician trainer for a hospital information system.
I'm sure you must be excellent at it and your students must be learning. But that's just one small number. Masses are just doing and learning by doing, and they're not formally getting trained. And it's a legal document. Each one of us should know it's in our safety that we should know how to write patient's case sheet. Because what is not written is not done. There was a time when we were called in the court of law and we said, I forgot to write, but I did this, we were trusted. Today, it's clearly one line missing. Overwriting, a lot of time we see overwriting. Even in this, you can see a couple of things overwritten, done but not documented. A lot of time, I again another gynec friend of mine. She said that a patient came to the OPD, not OPD. I'm sorry, emergency, general emergency. So the patient was in labor pain. Whoever the resident was, she wrote magnesium sulfate stat and moved to the labor emergency. So she was gynae emergency. So she was given magnesium sulfate, but unfortunately, the person who gave did not take mark or did not mention that treatment given. So the patient was moved with the case sheet. There in the gynae emergency, whoever received the patient, they thought that, okay, these are the instructions coming from the general emergency and we need to do this. So she gave a second dose of, repeat dose of magnesium sulfate. She said patient went into coma. I mean, and we had to really deal with a lot of complications. So you can well imagine complications that, and we land up into when we do, but we don't document. Another thing is documented but not done. We go to give an injection, the patient is not there, the nurse comes back and signs, okay, I've done it. I'll go and give it. But then in the end, either the patient hasn't come back or the nurse forgets or whatever happens, but patient does not receive the treatment. That also I'm sure you must have seen. Document not signed, dated, and I think this is something we see very common, not signed, dated or signed, which is again being re-emphasized every time. Language also is a barrier. People have poor writing skill. That's also a challenge. I'm sure you must all be seeing this across. So these are common errors you will see, and they are very dangerous, very, very dangerous, and we really need to resolve it right in the beginning. I think this should become part and parcel of the initial medical education. So by the time these students pass out, they should know what is the right way of writing at least preliminary documents, if not everything, the case sheet, the referral notes. When we write referral note, gynae resident, please come and see. And then we send it. What it is, why, what do you want to be done? No. So this is in a nutshell about return. I know this is a very long topic. We can go and on and on. But just to give you an idea that this should also be part and parcel of your training when you're working with the healthcare professional. Please make sure that you cover this also. The second part of communication is paralanguage. Language is what you say, paralanguage is how you say. And communication is not only what you say, it is how you say. Your pitch, volume, rate, quality, intonation, everything has a huge role to play, in the message that you say. Very honestly, 10% of the conflicts are because of the wrong words. 90% of the conflicts are because of the wrong tone of voice. And you will see people, when they use wrong tone of voice, the whole message gets completely distorted. For example, this is one sentence I've written 6 times. Just put little emphasis on the word that I have underlined and highlighted, and read this sentence, and you will be surprised to see that the whole meaning of this sentence will change every time. Roko mat, jane do. Roko mat jane do. Change the position of pause, the meaning changes completely. 38% of the communication happens through tone of voice. So we have to be really very careful about the tone of voice. A lot of time we don't intend to say that, but if the tone of voice is harsh or rude, the other person gets to, get confused what exactly, we mean to say. For example, when we are dealing patient and the family member in dealing our, co-workers, it's very important to remember that unfriendly tone of voice is inappropriate. Disinterested or unconcerned, they're going to feel that we are not, understanding their plight. If we are sounding inconfident, again, they will not be happy to communicate with you. They'll prefer going to somebody who wants to explain or talk in a confident manner. And anywhere, if we sound rude and authoritative, that's going to push people away from us. And if we are aggressive, again, there's a risk of violence because of our aggressive tone of voice. Appropriate tone of voice in public dealing is we need to be friendly. When I say friendly, I don't mean being friends. There's a difference between being friendly and being friends. I'm saying the tone of voice should be friendly, respectful, responsible, confident, soft and polite, and also assertive. As I said earlier also, assertion we'll talk at length in one of the sessions. And that's one way we can handle even aggressive people. If you're assertive, you can actually, soften even the aggressive person. Especially in public dealing, please remember inappropriate tone of voice can trigger extreme reaction leading to violence. And you must have seen, if the patient is aggressive and we also become aggressive, there's more chances of, aggressive reaction coming from others. So we have to make sure that we don't have to use high pitch, high tone voice in public dealing. When I say you have to be soft, I don't mean that if we are soft, if you're not audible, again, that's no communication. So we really need to balance the tone of voice and also the volume of the voice. Another important thing, some of us have tendency to speak at a higher speed. Please remember, especially when you're explaining something to somebody who is not at the equal knowledge or language, parameter. There's a risk the person may not understand exactly what you're saying. There can be miscommunication, there can be missed communication. So some vocabulary that you're using every day, you're very used to it. But for the patient and their family member, the same thing can be very new, something that they are not familiar with. They will not understand that one word and the whole communication will go haywire. So it's very important to give them time to not only try to comprehend what you're saying, but also in case if they have a question to ask, they can raise their question to us. So we have to really match our speed of speaking with the understanding speed of the patient. As I said earlier also, it's very important to learn the art and skill of assertion. By the way, what is assertion? What exactly we mean by assertion? What exactly we mean by assertion?
Make your point clear.
Excellent, very good. Making your point very clearly, very good.
communicating
making a impactful statement about what you.
Can you further explain what exactly we mean by impactful?
If you believe in what you are saying, you must be able to put it across with the same force.
Express it in a very
explicit way. Explicit.
Okay, done. Thank you. Yes, Dr. Menon, you were making a point. Go ahead.
I think communicating confidently with a firm tone of voice.
Wonderful. So when we say firm, are we sticking to a point? Sorry. When we say firm, are we sticking to our point? That no, what I'm saying is.
No, that would be aggressive. You are allowing the patient the opportunity to respond back.
Exactly. A lot of time we think if I'm adamant on a point, that is assertion. That is not assertion. But thanks for bringing this up. Open, honest, explicit. I think these are wonderful words. Dr. Sri Kumar, you wish to add a point. Please go ahead, sir.
Assertive means to explain things in such a manner, finally what you say happens.
No, honestly, no. A lot of time, see, for example, I am making a point and you make a point, and I think what I was saying was wrong, but I agree with your point. I should not hesitate in admitting, Dr. Vasudevan, what you're saying actually makes a lot of sense. I think I need to correct myself. That is assertion. So in assertion, I think I am saying this is one clarity we need to have. We think when I have a final say, that is assertion. No, there is no final say. Final say will be mutually agreed upon, mutually explored, mutually identified. So what other points you have added? Dr. Anand, you have another point to add?
I just like to give an example.
Okay.
So I had a patient who was admitted with me for treatment of his alcohol dependence. He had an eye injury as well because he had a fall. Now, when I had discussed with him, he told that he wanted to continue using alcohol 2 pegs per day. Now, this despite discussing at length the various complications that he has had throughout the alcohol use. So we finally came to this thing that unless his eye injury is taken care of, he will not use alcohol. Though he stuck to his point that he wanted to use, I asserted myself, telling that it is my opinion that you should stop using. But at the same point of time, I have allowed him an opportunity to communicate, and I have communicated the fact as a doctor that I believe that he should stop using alcohol.
Wonderful, wonderful. And at the end, if you said, don't come back to me if you don't stop drinking, then that is aggression.
Yeah.
Saying this one, according to me, you should not be taking alcohol for this time or whatever you want to say, because these are the reasons why this is not okay. But then when especially we are negotiating treatment with your patient, please remember, autonomy is patient's right. You may feel bad about it because we have always, worked as a paternalistic physician. We have always liked to have final say, but we have to come out of that mindset. If patient doesn't agree, doesn't agree. If they say DNR, but you say there's a risk, there's a possibility of survival, we have to respect their decision. It's difficult, I know, because we are not used to that kind of fight.
No, but does your expertise on that, I'm not telling it gives you a superiority, does it give you a responsibility of overcoming the autonomy of the patient, because he is deciding without having the knowledge of what he is going to go through. So
negotiation, Dr. Harimo,
no, you have to go through it because you're going to suffer this. Is it always arrogant, or is it fair enough? Because we know what is going to happen. Haven't we been doing the right thing in warning him?
So I need to explain to the patient advantages and disadvantages of doing or not doing. Inform the patient. And if the patient does not agree, I record in the patient's case sheet. I advise surgery, explain the risk involved in not getting the surgery done, but the patient and the family are not willing, which is their call. And they're okay with it, and you sign and you make them sign. So you have a documentary evidence that you did your job till the point where you even explained the risk involved.
That's called Mills-Harms principle, and that's called negative consent.
So the whole idea, sir, is to let the patient know that it is your decision, but my job is to provide you as much information, as much simple manner, so that you can take an informed decision. But if the patient decides no, if they want to go Lama, we have seen cases, patients going Lama. Family says, no, we don't want to continue. We can't force, but we can explain them the consequences. There we need to be non-judgmental, respectful, cordial. That is what is assertion. So that will, a lot of time, I'm sure you are in oncology, you will get to hear from children, if their mother or father, have cancer, they will come up to you and say, don't tell them. We don't want to let them know that they have cancer. We want them to die peacefully. But it's not just dying peacefully. There will be a lot of things that are left that need to be done before the patient dies. So there will be some last wishes of the person. So I can't argue with the patient saying, "Aap kaise bachche hain? Aap unki," but I can explain that it is important for them to be informed, because this is what is also important to them before they leave. So usually when you tend to discuss these things, they tend to agree. But then the final say is yours is not guaranteed. But you spoke honestly. So I normally say 5 things if you can keep in your communication. You can say it is assertion. You can note down these 5 points. Whenever you express yourself openly, like you said explicitly, when you are very openly saying what you have to say, honestly, there is no doubt you are honest. You say that in a positive manner. You are confident and respectful. So if I draw 2 things on our XY axis, one is openness and second is consideration for others. Assertion would have highest on openness and consideration for others. So when we assert, the idea is I will give my points, I will listen to you, then we will discuss. And if I think what you are saying makes more sense, I will very honestly admit, I think what you're saying is making more sense to me. I'm with you on this. That's assertion.
Shared decision making.
Yeah. Where you're not going back with, see, even if your clinical goal is something very vital, you need to. The only point where you have to stop is you have explained everything and the patient does not agree. You can't force the patient for it. Okay. So going further, I think in all communication, we have to learn the art and skill of assertion, because a lot of time you will have to converse on difficult issues, but you have to stay courteous, polite, and firm. We'll be talking about about this in depth. You will also get to know your communication style. I'll be sharing a questionnaire with you, a very interesting questionnaire. So you will get to know about your primary way of handling situation, and then what are the consequences of each style. That also we'll discuss in session 5. In session 5, so this is a little bit about communication part. Now coming to the body language part, which is the third part of communication. What do you see in this picture?
Harsh, loud.
So we haven't heard a single word, but from the picture we can make out that he's shouting at somebody, yelling, very annoyed, very aggressive. That's because 55% of the communication happens through body language. So body language includes, like you've already covered those points, that includes facial expressions, eye contact, gesture, posture, touch, space. This is something we really need to be mindful of. Please remember, we may be verbally communicating very well, but your actions speak louder than words. If your actions are not in congruence with your verbal communication, there will be a gap. Let's do a small activity. So you have to play with me. I'm taking you to your childhood. So you remember that poem? If you're happy and you know it, touch your nose. If you're happy and you know it, touch your ear. You're all with me? Set your hands free. Sit like this in comfortable way so that you can move your hands. Ready, everybody? Okay. So when I speak, you have to speak with me and also touch the part and then clap 3 times after we do it. If you're happy and you know, touch your nose. If you're happy and you know, touch your ear. If you're happy and you know, touch your chin. Now little faster. Okay, trial ho gaya? Now little faster. If you're happy and you know, touch your nose. If you're happy and you know, touch your ear. You were listening, but you were not listening because you were observing. So you were focusing on my actions. That's how people, when they are talking to us, they're looking at our facial expressions and body language. And from that, they are getting a lot of input about us and our behavior and the way we are conducting ourselves. A lot of time you must have seen that we don't smile when we talk to the patient. And I told you, which is the facial expressions we normally have. 1, 2, 3, 4, 5. Which one? Number?
5.
Number 5. And what is on number 5? What is on number 5? No expression.
Neutral.
Neutral.
Blank.
Blank. I think that's a good answer. Why do we keep this space, by the way?
It's a defense, natural defense, probably. Zyada paas na aa jaye patient.
How many of you would like to get treated by a doctor who has this facial expression?
Definitely not.
And as I said, we keep this expression with the purpose. We want to keep our patient at a hand's distance. Stay away, dare not come closer. Because I know if I'll smile, patient will ask a lot of questions. We'll talk more. I'll have to spend time. So,
not always, I think. Sometimes you may have a lot of issues in your mind. You may be tense. You may be thinking of the other patient who is sick. So I don't think I can generalize.
I agree. Most of the times when I say, I mean, not 100%. But mostly we have seen, some doctors don't smile at all. They've forgotten to smile. And we all know smile actually changes the milieu. It completely, suddenly makes the person relaxed. So if you smile and talk to your patients, they'll definitely feel better. I don't think we have time, otherwise I would have taken you through these pictures. Let me see if I have. No, we'll be losing time. Okay. Facial expressions like anger, irritability, unhappiness, attitude, they are visible on our face. Patient can make out that we are not happy attending them. We are looking down upon the patient, or we are irritated, or we are angry, and they are able to make out. So I'm sharing with you a quiz. I want you to see if you can identify emotions, because patients, when they come to us, not only that we have to be mindful of our facial expressions, but can we read their expressions? Can we read their expressions? So I'm going to show you a face with some expressions, and these are the possible options. Oh God. Okay. So I want you to tell me, what do you think this facial expression is?
Embarrassment.
Embarrassment?
Embarrassment.
Embarrassment. Okay. So I take this and let's see if it is.
Fear.
Fear. Somebody saying fear. Okay.
Fear.
Let's see. Let's see. Let's see. Fear. So embarrassment was not the correct answer. Okay. Next is, what about this face? Flirtatiousness, interest, happiness, politeness.
Happiness.
Happiness?
No, interest.
Politeness.
Interest.
Polite.
Which one do you want me to go with?
Happiness.
Happiness. Okay, happiness. Okay. Correct. Good. How about this one?
Anger.
Anger.
Sadness, anger, disgust.
Anger.
Anger?
I think this.
Anger.
It's saying disgust. Majority anger, majority anger.
Anger. Anger.
Okay, okay. I'm going with you. Anger. Okay. How about this one?
Amusement.
Amusement. Amusement.
Amusement.
Okay.
Embarrassment.
Embarrassment.
So see, it's not only important to be able to control our emotions, but also it's important to be able to read others' emotions. So this was just a small quiz, quiz to help you see if we can really identify emotions. Eye contact, another important, non-verbal communication. I'm sure many of you may have experienced this when you go to visit a government office.
Yes.
You're busy doing something, would not make eye contact. You are right there in front of them, but you are not visible to them. You don't exist for them. A lot of time we also do this with our patients and with our staff sometimes. So I think now you can see being there. In healthcare, making eye contact is all the more important. Why? Why is it important to make eye contact with your patients? Or even with your staff, for that matter. Why is it important?
Because it gives that you're honest to that person.
Okay.
You're
You are
open.
able to demonstrate trust and confidence and honesty.
Confidence builds confidence.
Confidence. Dr. Lata wants to add a point, I think.
To let them know that they are listened to.
Sorry.
Let them know that they're being listened to.
Oh yes. When you make eye contact, we get an idea that you are listening. Yes. Dr. Lata, you wish to say something?
He can assess the mental state of the person.
Absolutely. I think that's very important. When you look at the face, when you make eye contact, you look at their body language, facial expressions. Patient झूठ बोल रहा है, सच बोल रहा है, छुपा रहा है, डर रहा है. All that you can make out if you make eye contact and when you look at the patient. So a lot of information you will get, even the severity of pain. Sometimes patient would say, I have very severe pain. But if you look at the facial expressions, you have an idea it's not that severe as the patient is saying. So making eye contact is very important. Yes, of course, you need to demonstrate that I'm listening to you, I'm paying attention, and I'm trying to understand. Also, if they are not understanding from their facial expressions and eye contact, you will get an idea that they are not clear. They need more information or they need more explanation. There's a protocol for eye contact. In personal relationship, you can look at the eyes and below the eyes. But in professional setup, always look at the eyes and above the eyes. One should avoid, looking below the eyes in professional setup. Look at the person for 2 to 3 seconds, shift your focus. Please do not stare. It can be very challenging and recruiting to the person. And never look at the person from head to toe. Anybody will become uncomfortable when you look at them in this manner. In the next slide, you can see 2 postures, A and B, which is okay.
A.
A is okay?
No.
B.
B.
B is okay.
Is okay?
No, A is open posture. B is
Neither are. Neither
Both
are.
are not okay. All of you are correct. Both are not okay. In
Both are
A,
not.
the person is appearing very callous, very casual. In B, the person is appearing very closed. So an open posture encourages expression, and rocking in the chair again is not a good idea. So leaning backward also reflects this interest. The right way of, kind of connecting with your patient or to whomever you're talking, lean forward, nod. That will show that you are listening, you are kind of interacting. We are going to talk about it towards the end once again. Touch, again, non-verbal communication, a very important thing because we all invariably end up touching the patient for any reason. It could be some examination or some procedure, but it's very important to remember that it's very uncomfortable for the patient to be touched by a stranger. You may be uncomfortable because you are touching, the patient may be uncomfortable because the patient is being touched. We all know we can communicate empathy, compassion through touching, but now we also know that we need to be careful because a lot of time a gesture of compassion can create confusion. So we need to be careful, before we touch the patient. And in patient care, please remember that we need to be very, respectful. We need to signpost before we touch. What exactly we mean by signposting? Anybody? You can raise your hand. Signpost before you touch. So what happens when patient come in the OPD? We have a term called implied consent. And we think if patient has come for examination, patient is okay with examination. Please remember, implied consent, patient does not know. So it's very important to let the patient know. It may sound like a rhetorical question. I need to examine your throat. Is it okay? Answer will be 99.9% yes. But you're giving a choice to your patient to say no. So please make sure that when you are going to touch the patient, if you let your patient know that this is what I'm going to do, and if you give them the choice to say no, because I remember in one of the programs, it was probably, I think, the radiologist, or I don't remember who it was. He came up and he said that there was a patient, who was put for ECG. And mostly in those days, we had male technicians doing ECG. So this was a lady patient who went for ECG. She got her ECG done, came out and said something to her husband. This man literally went inside and caught hold of that person and jolted this person. How dare you touch my wife? So this can happen. And it's very important to seek permission. Usually they will say yes, but then it's our duty to give them choice to say no if they don't want to be touched. So it's touch, we know we can communicate compassion, care, but then we need to be careful. Sometimes it really creates confusion. So what kind of hand movements can upset the patient party? Patient party, or even with your own team members, staff members. So if one is in this picture, we can see he's saying go, get lost. Any other hand movement can you think of? So when we point finger and say, get out. Or you come inside. I don't think people do like, yes, Dr. Lata, you wish to say something.
Stop. Stop.
Yeah. Then you say, Dr. Tanzil, you also saying stop. So can you show with your hand what exactly you want to say? Same. Oh. So again, that doesn't go well with a lot of people. They feel that they have been, suffocated. Any other hand movement?
Oh my God.
Oh my God. Yes. Oh my God. So true. Thank you. Thank you for that. And what can I do? Is that my duty? Is that my job? So again, sometimes by mistake, we also point to the diseased part. आपका जो ये है ना, यहाँ पे तकलीफ है. So it can also misfire. So we really need to be careful. So hand movements, we need to be careful. I've seen some people, literally fighting with the staff for saying, "Kya aapne mujhe aise aise kyun bol diya? Why did you show your finger?" So you have to be careful. Hand movements like this, or stop, or hitting on the head. I'm going to add that picture in this slide. Can actually, upset the other person. Okay, whom does he look like? Whom does he look like? So I'm sure I need not be discussing this with all of you because you already are senior in your, profession. I'm sure you must be looking after your dressing and everything. But a lot of time we see residents wearing very unprofessional, dressed up in a very unprofessional. The problem is if they are not dressed up properly, they will not be respected like doctors. So a lot of time, junior residents, senior junior residents, they would come and say, "Ma'am, patients hame sister karke bulate hain. What do I do?" I'm sure in your young age also you must have seen something like this. Or the young doctors would come and say ki they don't treat us respectfully, they don't consider us like that. If you want to be treated like a doctor, you need to be, you need to dress up like a doctor. So in workplace, colorful dresses, something like very bright color, we don't advise. By the way, why don't we advise bright colors? Why don't we advise?
May not match with the mood of the patient.
Absolutely. Absolutely. If I am dressed up in a red dress with a lot of accessories and I'm looking like, going for a party, and if I come to the hospital, not this, sometimes very short dresses I've seen people wearing, very tight clothes people I've seen wearing, especially sometimes with young doctors. So I always tell them, see in your personal life, whatever you want to wear, it's perfectly all right because they're young. They should get the chance to enjoy their life. But at a professional place, I think we really need to dress up to maintain the decorum and earn the respect of our patient. So 3 questions I normally ask them to ask themselves when you're choosing a cloth. 1, ask yourself, does this clothes fit me properly? Is it too tight, too loose, or too short? Second question is, are these clothes comfortable? Because we all know that once we enter the hospital, we are there for 10, 12 hours. So these clothes have to be comfortable in case I need to bend down, in case if I need to stretch myself, in case if I need to lie down, my clothes should be comfortable. And then am I dressed appropriately for my position and responsibilities? So this is something that I think I would really want you to talk to your residents, nurses, and young doctors, because they don't sometimes take it seriously that it's important to dress up in a professional manner. That a lot of people, looking at us, they think, oh, you are very smart, intelligent, or very knowledgeable. That's how people normally have the perception. Okay. The next point is about personal space. We all carry a bubble around us and we want people to, respect our bubble. So how much of distance with the patient is okay? How much of distance with the patient is okay? Go ahead, please. Try it. Even if it's wrong, what difference will it make? Normally, how much distance do you maintain with the patient when you are interacting? I can see an answer.
1 meter.
50 centimeters. 1 meter. No, 1 meter in all consultations or in a particular situation? Because 1 meter is quite a bit.
Different times, the distance would be different.
Yeah. But mostly if you are interacting with the patient, your patient has come to the OPD.
Maybe one hand.
Around 1 hand. So approximately 2.5 feet distance we normally maintain with the patient when we are interacting. But there are times when we need to go closer, especially when you are going to examine. So again, very important, if you're going to go closer, we should signpost before going closer and also seek permission. If you need to examine patient's ear, they need to tell that I need to examine your ear, I'm going to examine it. So that mentally they get prepared, okay, I'm going to be examined now. Another important point while handling your patient is respect their privacy and confidentiality. This picture was sent by one of the participants. Imagine the plight of this child and also the parents who are observing this thing being done for their child. A lot of time we use patients as our learning opportunities. We need to be more respectful. So, if I may ask you, how do patients lose their time or waste their time?
Playing with their mobile.
Mobile phone.
Playing with their mobile.
No, my question was, when the patient is made to wait, a lot of time we make them wait. They actually, they're made to wait. I'm not saying that always for a wrong reason. A lot of times it's a valid reason. A lot of time after making them wait, we say, sorry, aaj nahi hoga, aapko kal aana padega. Or we make them wait, and then we say machine kharab ho gayi. Or we ask them to come again for something that can be done at the same time. So valuing patient time and reducing their number of visits as much as possible is in our benefit. A lot of time we make them wait and then we say, okay, we can't do it today, you will have to come again. So patients feel bad that their time is not valued and that they are made to wait. The whole idea of this discussion is to ensure that we display respect and care at every point of contact. And it's not just the doctor's responsibility. Everybody and anybody who's dealing with the patient should remember they have to handle their patient in a respectful manner. So a couple of things that we need to avoid when we are interacting with the patient, when somebody is talking to us, when we start looking away, they clearly get a message that I'm not interested in listening to you. Or we start staring at the person. We start looking sarcastically, indicating that what you're talking is nonsense. Sometimes we close our eyes to show disinterest. Verbally, we may not say anything, but non-verbally, we are communicating and not interested. Some of us use unpleasant tone to snub the other person, play with phone or busy doing something, or we start walking away. I think these are common things that we do sometimes, not realizing that the other person can read this. Okay, so I have summed up everything in 5 essential skills that we all have to keep in mind. And if you can remember those 5 skills, I'm sure you'll be able to do justice to your work and your patient. But I'm not going to cover those 5 skills now because I know it's just 2-3 minutes to 10 o'clock. I will not hold you further. We will discuss that in session 3. And then we will cover session 3 also in the same session. That will be next Tuesday. Am I right? Okay. So I wanted to ask you, next Tuesday, actually, I'm traveling to Udaipur for 2 days program. Can we have it on Monday if it suits everyone? Anybody who's not okay with Monday, if you can.
Madam, Monday and another program was fixed in view of Tuesday have this being there.
Okay. If not Tuesday, if not Monday, can we do it on Thursday? Anybody who has challenge with Thursday?
Next week?
Yes, Dr. Lata, please go ahead.
I have actually a talk on Thursday.
Late evening, 8 to 10?
Yeah, it starts at 8 o'clock.
Friday?
Friday also.
What is the date, Friday?
Friday is 19. See, I can take this session on Tuesday also. My flight is in the morning. My session would end by 5 o'clock. So by 8, I can sit and do it in my hotel room. My only concern is in case if there is some network issue. Because at home, you have proper network. In hotel, sometimes there can be a challenge in the network. That was only the concern. Friday also you have problem, all of you? And
Madam, you said Tuesday is 9.
sorry?
Next Tuesday is 9.
Next week, no? Next week, Friday is 12, right?
Actually, Wednesday is also a session. So Wednesday also I'm going to postpone. 10th, that is 10th.
10th is not possible. Not possible.
10th is not possible. Actually, I'll be traveling at that time. Even that session will need to be postponed. I will be postponing to another day. 11th, 12th, I have session, but they're all day sessions. So evening, I'm free. I can do an 11th or 12th. But if it doesn't suit, then we will stick to 9th. And in case if there will be a network issue, then we will have to take a call at that moment. Is that okay? I'll try carrying my, additional, what do you call that? Modem.
Hotspot.
Yeah, hotspot. No, Wi-Fi, but router. I'll carry that with me. And hopefully we should be able to do it. In case if there's some challenge, then we'll see what we can do. But I'm just keeping you informed so that because I'm traveling on 9th morning. So evening, there should not be a problem. Session will end by 5 o'clock. So I'm sharing the feedback form with all of you. I request you to give your feedback before we disperse today. Any questions about whatever we have discussed?
The next session is on 9th.
Yeah, we are going to have the next session on 9. And in case if we had any challenge, network issue or something, then we will have to take a call at that moment. But as of now, the session will go on. That's why I did not cancel even today's program. I said I'm coming back today, but I will not change because otherwise there will be a lot of changes happening. So therefore, no jet lag. Okay, so I'm sharing the link for the feedback form. Please give your feedback before we close the session.
Got the form.
I think Dr. Harimohan has joined just now. Sir, I'm sending the feedback form. I request you to give your feedback.
Sorry for that. There was a
I
total.
know you have written that there was a power failure. That's okay. Not in anybody's control. So I've received 9 responses as of now. So did you get the form?
I've not got the form.
Can you put in WhatsApp?
Sorry, do you want me to WhatsApp the form?
Yeah.
I can do that.
Coming.
Have you sent it on WhatsApp?
I'm trying. 1 second. I have to copy and send now. Yeah. Yes, I've shared. I can see a message in the chat box. Okay. Power failure comes under circle of concern. Yes, Dr. Punji, you're right. It's not something that you have control over. So I've received 10 responses. Others are still doing. If you can just raise your hand and show me who are still doing, I can. And if others want to leave, they can leave. I know it's already 10 o'clock. So I've received 10 responses, waiting for others to complete. Thank you for your feedback. Thank you.
I can leave, right?
Yes, sir, you can.
Thank you. Good night.
Good night. Those who have completed their feedback form, if they want, they can leave.
Hello, ma'am. I hope you received my mail feedback. Did,
I sent it.
ma'am, you've received my mail, no? Okay. Thank you, ma'am.
I sent it by WhatsApp. I hope you have got it. My response through WhatsApp. Dr. Mukundan Nambiar. Got it? Ma'am? No?
Sir, thank you for your feedback, but I cannot see your name in the answer list.
Is it?
No, I'm not able to
I
see.
sent by WhatsApp.
Can you take help of any of your family member who can help you?
No one is around.
Okay, you can do it even tomorrow. It's okay.
Oh, it's okay. Okay, then I will do it. I have already done it, but then I don't know what has happened here.
Yeah. We can do it tomorrow morning. Yeah, sure.
Okay, fine. Okay, I will do it.
Thank you. Good night, sir. Good night.
Oh, good.